Down syndrome child, this mandibulomaxillary line will not go like this, it will go like this. Why it will go like this? Because this part of the maxilla is lacking. So maxilla will stop here. So the mandibulomaxillary line will come here. So that is one secret we should understand. Instead of 32 tooth sockets, you will have 28 or 26 or 27, 29, 38. Now second important thing is, in a Down's child, I am drawing you an important parameter. Okay. Now you can see the frontal bone, you can see the nasal bone. Okay. Fronto-nasal junction. At the fronto-nasal junction, you can see the subcutaneous edema here. This is the prefrontal edema. Okay. Now, this prefrontal edema is increased in Downs and the maxilla is small. So what I do, I just take the baseline as the mandibulomaxillary line. Okay. Once I draw the mandibulomaxillary line, now I just take this ratio of the distance between the tip of the skin and the prefrontal edema. So I have got A value, which represents the mandibulomaxillary line continuation, and I have got the B value, which represents the prefrontal thickening. In Down syndrome, A value is less and B value is more. So A bar B is almost 1 here. In Downs it is A bar B is 0.2. Am I confusing you, friends? Okay. So we will go back. We will go back now. Just you are seeing the mid-side view of the face, correct? Is this view okay? Is this clear now? Okay. Now in this view, concentrate on the mandibulomaxillary line. This is the mandible, the manti. Is this point clear? You saw the tip of the maxilla? So did I extend this line now? Okay. So what will be this line in Down syndrome? It will be like this. Easy? So the gap between the skin and this line will be less. The gap between the skin and this line is more now. Simple concept. So take that ratio and measure the skin thickness. So give that ratio as A and give the skin thickness as B and take A bar B. Confusion? No. Okay. Huh? So what do I do now? I establish the mandibulomaxillary line and I take the ratio of the prefrontal edema to the mandibulomaxillary line and I call it as the prefrontal skin thickening ratio. What is it called? PFSTR. And what is the value here? 1.26. Okay. Now how did I get 1.26? 4.3 millimeters is the mandibulomaxillary line extension to the skin and prefrontal. Okay. So in Down syndrome, what happens, I tell you, the mandibulomaxillary line will come like this and the prefrontal skin thickening will be here. It will go like this. Here it is now, but it will come like that. So if you take the distance, it comes like this. So what is the PFSTR now? It is 0.27. So PFSTR is a very important marker of both maxilla shortening and prefrontal skin edema. Now one important thing which all of you should concentrate as a screening marker for Down syndrome is the position of the tip of the tongue. Just concentrate on the tip of the tongue and the tip of the maxilla. This maxilla is never a box-shaped maxilla. It will go behind in trisomic retina. Okay. Is it too much, friends?